Hey everybody, welcome back to another video on how to improve your brain health, how to improve your cognitive function, and how to reverse Alzheimer's disease and dementia. And again, we are following along with this book that I read recently. It's called Reversing Alzheimer's by Dr. Heather Sandison. So this is the second video in the series. In the first video, I went over the 6 components of brain health and gave you 6 tips to improve each of those areas. And in this one, I just kind of want to real quickly lay a broader term out, or a broader concept out about what the problem is with current Alzheimer's research and current Alzheimer's treatment approaches, which is then going to help us understand this better approach, which is going to be laid out in this book as we go through it. So if you are following along with the book and you already bought it and you've been reading it, I'm actually on page 31 right now. And we're going to talk about what is wrong, again, with Alzheimer's research. And the biggest thing that's wrong with it, and then in terms of treatment, is that all of the research so far, in terms of like pharmaceutical interventions, that's a problem in and of itself, is that we're always trying to treat things with pharmaceutical interventions when there are very much modifiable risk factors that have significant improvements. But the biggest problem is that all of the research has basically been focused on reducing plaques and what they call tau tangles in your brain. And so when you look at Alzheimer's disease, historically speaking, when they first started looking at it, they had this one lady that they looked at who actually had a rare form of Alzheimer's. There's 2 common forms of it. She had the rare form that basically she had a genetic predisposition to it, and she had a very aggressive Alzheimer's disease at a young age, which is not common. It's very rare. 98% of people have the second type of Alzheimer's disease, which is just kind of like typically after age 65, you start to gradually have the cognitive decline. And obviously that can be faster for some and slower for others. But anyhow, so what they saw with this lady, she had all sorts of these plaques and tangles in her brain. And so that kicked off the research. And this was quite a while ago. I don't even know what the year it was. It's in the book here, if you're following along. 1906. So anyhow, so the researchers started to look at this and say, okay, the cause, this lady had all these tangles and plaques. And when you look at other people with Alzheimer's disease, they have tangles and plaques too. So therefore, the cause of Alzheimer's is the tangles and plaques. And therefore, if we can decrease the tangles and plaques, Alzheimer's will get better. Cognitive function will get better. Outcomes will improve. And basically, that's the problem, because they were wrong. So they were wrong because when you create these medications after millions and millions of dollars of research and studies and things like that, and you're able to reduce these plaques and tangles in people with Alzheimer's, unfortunately, the outcomes don't improve. Their cognitive function doesn't improve. At the very best, with more recent medications, they can slow the progression, but they've never improved it. So that's the single biggest problem with Alzheimer's treatment, is that we're looking at improving this thing that we can measure and we can see, which again is those plaques and those tangles, in order to improve function, and it just doesn't stack up in reality. And unfortunately, the pharmaceutical world has not changed gears and has not started to say, okay, what can we do? So that's the biggest problem. So then when we go through this book, what you're gonna find then is that there are all these modifiable factors that we can have an improvement on, like diet, like exercise, like sleep. There's a whole list of them that I'm going to do in the 3rd video in this series. There's all of these things that do show, if you improve them, that they improve your cognitive scores, specifically on an outcome measure called the MoCA, which I'll get. The definition is in here somewhere, but it's the MoCA, the M-O-C-A. But this is a cognitive test. And then it's also improvements in functional scores, like can you go out and walk? Can you speak? Can you dance? Can you do these things that you've lost the ability to do? So that's the biggest problem with Alzheimer's research. And then as we shift gears to the solution, the better approach to this is all of these things that you can impact yourself, that don't require super expensive medications, that actually have been shown and proven in the research to improve your quality of life. So stay tuned for that. I'll get to that in the next video. That'll be my 3rd video, and we'll talk about all these things you can do. In the meantime, please leave me a comment below if you liked the video, if you have other, if you agree, disagree, let me know. And if you have other advice for people, just put in the comments below. Thanks. I'll have another video for you soon. Bye.